Hello everyone, it's Mike Spigler again from the American Kidney Fund. Today I want to talk to you a little bit more about dialysis centers and what you're seeing when you go to your appointments at your dialysis centers. For those of you doing dialysis and in-center appointments, you're going to see a lot more probably cleaning that's happening now. They already had really good infection controls already, but they're doing even more of that now. You're probably going to have to wear a gown when you go into the dialysis appointment, a mask in the waiting area. But the most important thing for in-center dialysis patients is to make sure you're in communication with your team there. You want to make sure that if you're having any flu-like symptoms whatsoever, fever, coughing, nausea, gastrointestinal problems that you may have, those are the things you want to communicate with in advance of going to the center so they can screen you when you get there, because then there's some procedures they can put in place to protect you and the other patients there. There may be a separate room they put you in. There's been great collaboration between the dialysis companies in the midst of this pandemic. I've been very impressed by what they're doing. They're working together to make COVID positive centers and COVID negative centers. So in other words, if you're a patient that's tested positive for COVID, it's much better to be in a dialysis center than to be in a hospital unless you're that sick that you need to be there. Everyone knows right now the stress on the medical apparatus is really bad right now. So you want to try to be in the center as much as possible. So because of that, you may be asked to move to a different center, to dialyze on a different day, a different time. And even if you're healthy, you may be asked to do that to make room for other people to have that done. For those of you doing at-home dialysis, the major thing I want to stress to you, and thankfully you already have that training and you're ready to set up to do that at home, is to try to take advantage of telehealth as much as possible. There should be almost no reason to go in now unless you're very sick. So use the telehealth options now. If your provider's not doing that already, make sure to contact them and find out how to take advantage of that. So those are the two main things that you'll be seeing for patients right now. So if I have three main takeaways, number one, for in-center patients, communicate, talk to your center there, and use this as an opportunity when this is all over to find out, can you be trained for a home dialysis therapy, because this is a great example of why that would be much advantageous to you right now. For those of you doing at home, ask about telehealth. And for those of you that are still struggling or want to help those that are struggling, we have twice the amount of need for what we have funds available for our Coronavirus Emergency Fund. Again, it's a $250 grant for patients. We desperately need your donation. 100% of that goes back to those patients. And you can find out more information on all of those things I just talked about and how to make a donation or the fund itself at kidneyfund.org/coronavirus. Thank you. Stay safe and stay healthy.